I'd like to welcome you to the 3rd Annual Social Marketing Conference here at the National University of Ireland, Galway. We're glad you're here, and we hope that you find the day insightful and inspiring. This year's theme is an important one, and one that seeks to address head-on some of the major issues that confront us in Ireland and beyond. Our theme, as you know, is enabling sustainable behavior, the environment, communities, health, and well-being. Our goal today is to learn from our guest speakers, Doug Mackenzie Moore and Craig Lefebvre, and from one another, so that we can address the concerns that affect us and our communities here and now and into the future. We face a lot of difficult choices, and we will be expected to do a lot more with less. But it is the hope of this meeting that social marketing may help. I am confident that what we learn here today will be of help, and that it will be timely and practical and relevant as well. The issues that face us in the 21st century present us with no small task. In the 21st century, despite solving so many of the problems that have plagued us in the past, we are now plagued with new problems. And interestingly, these problems are associated with the success of our societies, believe it or not. What kinds of problems do advanced modern economies face in the 21st century? We face problems associated with climate change and how to reduce our carbon footprint, how to reduce the production of carbon. We have problems associated with pollution of other types that affect our air, our water, our soil quality, and the Earth's resources. We face problems associated with our dependence on fossil fuels and automobiles. And we also face problems associated with matters of human health and well-being. These include the plague of adult and childhood obesity and diabetes too, health disease and cancers, all of which are extremely serious and costly. We also are faced in modern society with problems associated with depression, anxiety, stress, and substance abuse, some of which is from prescription drugs. And we face diseases and costs associated with our aging populations. And of course, there are economic problems. We hear all about that daily. And there are problems that many of us don't have to face, but are critically problematic around the world, such as war, malnutrition, and types of severe poverty that most of us could not even imagine. But there is good and bad news. The good news is that most of the problems we face can be solved by human beings or seriously mitigated by the actions and behaviors of human beings, in part because a lot of these problems are created by human beings. But this is also the bad news. Human beings are incredibly complex. They don't always want to do the right thing. They don't always want to change. They don't necessarily want to do the right thing for the planet or for others or even for themselves. And often they don't really understand what the right thing is. Or there may be barriers that make it difficult for us to change and do what is right. So yes, human beings are complex. As a social scientist, I find myself smiling when I talk to my friends who are physicists or chemical engineers or biologists, and they tell me that they're from the hard sciences. Well, as a hard scientist, or sometimes they just call themselves scientists, I study the hard sciences, they say. Well, this may be true, but their subject matter does not require that they come to understand human beings. Surely, the social sciences, which focus upon human behavior and human weaknesses, are harder to study still. I think social science is also hard science. What I like about today's speakers is they understand, or are attempting to understand, the complexities of human beings and the difficulty of changing their behaviors. They understand that change is far from simple and that it takes multiple approaches. For example, you just can't simply advertise or educate people to change. Information usually isn't enough. Simply laying out the costs and benefits of certain behaviors will not necessarily lead to the desired effects. For years, for example, we tried to educate people about the dangers of smoking. We educated, we advertised, we marketed. And sure, this did have an effect to some extent, and it did save some people's lives. We shouldn't underestimate that. But it wasn't enough. And we raised the taxes on cigarettes, and that worked some too, but not enough. Because people are complex and stubborn and good at avoiding messages and rationalizing things away, and sometimes they just don't understand it. But as a social scientist, or more specifically a political scientist, I also know that a lot of what it takes to make change happen is social and legal. Part of what makes change happen has to do with social norms and expectations, and public policy, and the law, and whether it's enforced or not. When Ireland decided to ban smoking in the workplace, nationwide, and in pubs, we saw the additional effects of the social and the legal. A new social norm was created, and it was emboldened by the force of law. Smoking in the pub, and even in the home to some extent, became an unacceptable behavior. And it was enforced, this is the key, it was enforced not by the police or an enforcement agent, but by the people themselves, by the culture, by the social norm, by the expectation. A new social expectation and norm, one that had no doubt been building for a long time, enabled a real change in behavior. So social norms and expectations do matter. They matter in many ways. The expectations we have for what is a socially acceptable weight matters for obesity. Our social understandings of what is a healthy meal or a healthy portion size matters. And we develop all sorts of norms and expectations around others' behavior, about drinking, about driving, about the temperature our home should be, or even how we heat our homes. This is key. The expectations that others have of our behavior matters. The expectations that others have of our behavior matter. Part of what causes change is to change our social understandings as to what behaviors are acceptable or unacceptable. And we'll hear a lot more about this from today's speakers. We'll also hear about barriers to change. Sometimes change is difficult for reasons beyond our control. For example, it's a great idea to ask children to walk to school and adults to walk or cycle to work. It has health benefits, it's good for the environment, and it's good for the family pocketbook. Oh, and it reduces traffic. But sometimes the places we live in are so poorly designed for the pedestrian or the cyclist that it becomes dangerous to walk because our communities lack proper footpaths, or because of the speed of traffic, or because of the width of roads, or because of roundabouts. It's the danger from cars and the design that is causing the decrease in walking or cycling. Some change is enabled by the environments we create, and other behaviors are discouraged. So to address change successfully, we have to address the barriers in our way. Finally, I'd like to say one last thing about change and behavior. The idea comes from E.E. Schatzschneider, an American political scientist. He wrote a book about how change can be contagious. And he tries to understand why it is that sometimes change is contagious and takes off, and other times it doesn't. Sometimes, and this change can be for better or it can be for worse. New expectations or ways of thinking can become a tremendous force or even trendy. And it is the job of the change agents to figure out how to make change contagious in a positive way. The changes that are occurring now in the name of democracy, human dignity, and better governance in North Africa and the Middle East are contagious. People are beginning to see the same problem and the same solutions in similar ways, and are willing to act for change. They're changing the behavior. And of course the trick now in these places will be whether that change is successful long term, which will take great skill, will, leadership, and vision. And that is also something that social change requires, and is one of the reasons you're probably here, to be leaders for change. I look forward to today's presentations, and before we begin, I'd like to briefly thank some of the organizations that made today's event possible. These include NUI Galway, PRT Leyden, the university's research office, the Millennium Fund, the Galway Healthy Cities Project, and CISC. CISC is, I'm proud to be affiliated with CISC. CISC is the Center for Innovation and Structural Change. Its main goal is to bring together researchers and faculty and students who want to focus on research that matters for communities and business. And what I really like about it is it tries to look at things differently and innovatively by bringing people together across disciplines. So we thank CISC as well for sponsoring this event. And of course, we have to thank our coordinator, the person who coordinated the entire conference, and this is Dr. Christine Damigan. She's Senior Lecturer of Marketing, who you heard from briefly, you'll hear from again today. Christine is very good at making big things happen. And finally, I'd like to thank you for attending.